So last night, I was notified that an Anne Arundel County man, whose name I do not know, lost his battle with COVID-19. We want his family to know that we are sorry for their loss. We are here for them, and we will pursue this struggle in his memory. So COVID-19 is infecting Americans at a faster rate than it has grown in any other country. We don't know how many Marylanders are infected because test results come in 4 to 7 days after the swabs are taken. And only one other state has fewer numbers of reported tests taken. So in Anne Arundel County, the infection rate is doubling every 2 or 3 days. Our hospitals are doing the responsible thing and canceling effective surgeries to make room for a patient surge. Efforts to add hospital bed capacity are underway, but progress is slow. We were asked yesterday by the state to identify hotels and other large spaces where convalescent care could take place, and that work is underway. So without widespread testing and without either a vaccine or a cure, we are left with one strategy to slow the spread of this virus. Every single one of us must act as though we are a carrier of COVID-19, because even without symptoms, we could be. Social distancing and isolation are not how most of us want to spend our spring and even part of our summer. And nobody is happy about the economic impact of this battle. But this is where we find ourselves, and this is the challenge that we must meet. However, this is not the end of the world as we know it. Life continues, and we can adapt. We can even find joy and appreciate the good things around us. And speaking of good things, I am very lucky to have with me today, not too close, but still with me, some very, very good people. Dr. Nilesh Kalyanaraman is the leader that our heroic health professionals need in a time like this. He is always on the job, he always tells the truth, and he is always on our side. Karnitra White leads our social workers. She understands the struggles, the people they serve, and she understands the stress that they are under as they work to protect our most vulnerable residents, the ones who don't have the resources that it takes to get by at a time like this. And Rosa Cruz is here, representing the team at our Economic Development Corporation. She is in regular contact with our small business people, many of whom are unable to pay their employees, unable to pay on their loans, and unable to pay their rent because revenues don't exist for them right now. And my friend Bishop Antonio Palmer of Kingdom Celebration Center in Odenton, not far from where the stores at Arundel Mills Mall and Live Casino employed thousands of people until just last week. Like many churches in our county, Bishop Palmer and his parishioners are doing God's work through food distribution and services for all. I want to share some good news. Some good news from what most of us would say is an unlikely place. Some good news from the United States Congress in Washington, D.C. We heard last week at this event from our very own Congressman Anthony Brown. Earlier this week, I spoke by phone with both Congressman John Sarbanes and Dutch Ruppersberger. But it was Thursday night that I heard from both of our Maryland senators, Chris Van Hollen and Ben Cardin, after they took what was an old-fashioned economic stimulus bill and turned it into a carefully targeted aid package that actually puts money where it's needed to help our county residents who are losing their jobs and their income. The Coronavirus Aid Relief and Economic Security Act, CARES Act, is 800 pages and $2.2 trillion in programs, so I won't get into the details. But this bill will have a real impact on our residents, on our hospitals, and on county government's ability to act locally where we need to act. Consider this. Unemployment insurance will be available to hourly and self-employed workers who were ineligible before. And on top of the scarce money that they get to cover their costs under today's limits, everyone who files will get an additional $600 per week. To apply for unemployment insurance, go to Maryland Department of Labor's website. Traffic is high, so please be persistent. But there's more. Even if you don't lose your job, the federal treasury wants you to spend money. So they'll be depositing $1,200 into your account or sending you a check for that amount unless your adjusted income is over $75,000, in which case the number declines as your income rises. You also get $500 for each child. There's plenty of money in this for large and small businesses in the bill as well, but in this case, that can work. There's a rule that they can't get the money if they lay off more than 10% of their workers. And much of the money is a taxpayer investment that will have a return when these businesses bounce back. Arundel County is projected to receive as much as $99 million to offset our emergency coronavirus spending. And there is a direct assistance to hospitals, homeless assistance, and student loan deferment in addition to that. To some people, all of this federal money might sound extravagant. I worry about the national debt as well. But there is a sound economic case to be made that this investment will pay off, not only for American families, but also for the federal treasury. We are saving our people and we are saving our economy. One of our challenges as a local government is to effectively take advantage of what the federal government is offering. We have the smartest, hard-working people in local government anywhere, and they are spending this weekend making plans to pursue every dollar of these funds that we can get for the residents of our county. Before I turn over the podium to the other speakers, I want to skip through a few highlights of what we've been doing this week. While county government buildings are closed to the public and all staff who can work from home are working from home, county government continues to serve our residents. Police, fire and EMT, public works, budget and finance, law, health, social services, mental health agency and crisis response, planning and inspections and permits, central services and purchasing, our housing authority. I could go on and on through every agency. But my point is that the work continues and the people in these agencies are creatively adapting what they do to serve our residents in ways that they never expected just a few, what seemed like very long weeks ago. Here are a few examples. You might want to grab a notepad and a pen to write down some phone numbers and some websites as I go through some of this incredible work. Attendance at county parks is up 35% from this time last year, and that is a good thing. We have waived fees at our regional parks, but please practice social distancing and don't use our parks as gathering places. You will be asked to disperse if you do. On the child care front, since our last town hall, since our first town hall, actually, I promised free child care for the children of our essential employees and healthcare workers. We plan to offer this service in schoolrooms where child care is provided by our Rec and Parks team when school is open. We were delayed when the state of Maryland made a decision that counties could not do child care in our schools. So this week, the state closed all private child care centers, but told them that some would be approved to reopen next week to exclusively serve children of businesses and agencies that have not been shut down, including essential businesses and stores. A list should be available of those sites at marylandfamilynetwork.org or by calling 877-261-7856. I know that they're building that list as we speak. But our team at Rec and Parks developed an alternative plan so that we could get started quickly and meet what we expect to be a very high demand. Yesterday morning, the state approved our plan to open 2 separate rooms for 8 kids each at our first 3 sites. Those are South County Rec Center, Arundel Swim Center on Riva Road in Annapolis, and North County Aquatic Center in Glen Burnie. We put the application information online midday yesterday, and by the end of the day, those 48 slots were filled. One single mother who works in a hospital told our staff through her tears just how grateful she was to have a safe place for her daughter so that she could get back to the job she was trained to do at a time when she is most needed. Rec and Parks is working on a plan to open senior centers for childcare this week and will continue pressing the state to allow our team to use our childcare rooms at schools. Parents can contact Rec and Parks Child Care Division through its website or by calling 410-222-7856. Parents will pay nothing for this child care. The cost will be reimbursed to the providers by the state. Our call center here at the Emergency Operations Center has received 1,800 calls and is working hard to get information to every caller. The number here is 410-222-1600, and I urge you to use this number. You can also email them at eoc@aacounty.org. Our winter relief program has been extended. Local churches alternate sites in our county to provide shelter in the winter to people who are homeless. That program would have ended this week, except for the generosity of Bay Area Christian Church. They have stepped up to extend the program, and an email was sent yesterday to all county staff asking for help staffing the site. So thank you to everybody who signs up for that. Note that we have a ban on evictions, foreclosures, and utility shutoffs in effect. We are in the process of expanding our mortgage counseling program at Arundel Community Development Services. At Anne Arundel County, at aacounty.org/coronavirus, you can now access an interactive map of all free food distribution sites in the county, including the school meals program, the senior nutrition program, and food pantries. You can also access on that site a listing of special shopping times for seniors at grocery stores. The senior nutrition program has adopted a new service whereby a week's worth of easily prepared meals are available every Tuesday from 11 a.m. to 1 p.m. at all of our senior centers. Aging and disabilities and volunteers from other county agencies continue to call 10,000 of our seniors each week, and some daily for a check-in. Thank you to the crews doing that work. Our health and social service teams continue to visit all assisted living homes and homeless shelters and other sites where vulnerable populations are housed in close quarters to do testing for symptomatic residents, provide guidance on social distancing, and in some cases, provide alternative housing at local hotels. Our Anne Arundel County Public Schools team is continuing to innovate. My 2 fourth grade boys have been online each day doing the lessons that are offered as quickly as they can get them done. Superintendent Arlotto announced yesterday that there will soon be programming that is more interactive and more comprehensive and more time-consuming for the kids. So my message to the kids is that this is your opportunity to take charge of your education. Do the curriculum that is offered online, but also explore what you're interested in. Take some time to practice your writing skills. In fact, I could use some straight talk and wisdom from kids right now. So please send me an email with your concerns and your ideas at countyexecutive@aacounty.org. I won't be grading the emails, but I will be reading them. As layoffs spiked and unemployment claims increased 30-fold in our county last week, our team at Workforce Development is stepping up to help find work. The big box stores and some industries are actually still hiring. So go to aawdc.org to get their virtual help finding work at an essential business that is working to meet the needs of our residents. I know that many of you are eager to help. You can offer your time by calling EOC@aacounty.org or the number here at 410-222-0600. Hopefully that number is sinking in. You can also donate supplies. A list of needed items is now at aacounty.org/coronavirus. Our drive-through donations management facility will be fully operational on Tuesday morning. Please call the number here, which I won't repeat, to let us know you're coming, but be aware that the site is at 1370 Blair Drive in Odenton and is open for donations only from 10 a.m. to 2 p.m. Monday through Friday. You can also donate the same supplies to Anne Arundel County Food Bank at 120 Marbury Drive, which is at the old Crownsville Hospital site. They are open from 9 until noon, and 1 to 3 Monday through Fridays. And finally, if you have financial resources to contribute, please consider the Coronavirus Response Fund at Community Foundation of Anne Arundel County. You can donate online at cfaac.org. So, last week, I encouraged you to breathe, to get outdoors and enjoy the spring, to read a good book, connect with family, and take care of yourself. I hope you've done some of that, and I hope you're getting good at it. This will go on for a while. It will get worse. People you know will get sick, and some may even die. When you look back on this time, I want you to have no regrets. I want you to believe that you did what you could. You protected people and you helped someone. You acted in a way that saved lives. If enough of us emerge this summer or fall having met that challenge, I can guarantee you that we'll find ourselves in a better county, in a better country, and in a better world.